Good afternoon, everyone. I'm Ouida Spencer, the incoming chair of the Board of Trustees for United Cerebral Palsy, which is making its 75th anniversary this year. I'd like to begin by thanking all of you for joining us for the second day of our three-day UCP 2024 conference on Latinos with Disabilities. I also want to thank this year's sponsors, Waymo, Source America, and Anchor, all of today's presenters, and most especially you, our audience, for making this event possible. For those who may not be familiar with UCP, we're a network of 55 affiliates in the US and Canada, serving more than 150,000 children and adults at all levels and abilities. Through our national network of affiliates, we offer supports and services to individuals with cerebral palsy and all other developmental and intellectual disabilities. Our services are designed to help individuals achieve their fullest potential, become active community members, and improve the quality of their lives. Our UCP staff across the country truly do make a difference in the lives of the people we serve. This conference, along with our research initiatives, national advocacy efforts, and community outreach programs, provide other ways that UCP helps tens of thousands of people with disabilities and their families every year. What I hope you take away from this conference is a better understanding of the role, impact, and influence of Latinos in the disability community, along with the vital role that you play in advocating for yourselves and others at the voting booth, in the communities where you live and work, on social media, or in the general public to achieve a better quality of life for everyone. Having been a decades-long advocate for the Americans with Disability Act, which provides access to public places, fair housing laws, which prohibits discrimination in housing, both of which encourages other critical public policy initiatives vital to people with disabilities, I've learned that by working together, we truly can make a difference. Thank you for supporting United Cerebral Palsy and our mission to help people with disabilities as they aspire to live life without limits. I hope you enjoyed today's presenters. Now, please allow me to introduce the founder and coordinator of this conference, James Garcia, who will also be serving as the moderator for today's panel discussions. James?
Hello, I'm here. My video is not on, and I'm getting a message. It says, oh, here it is. It says start my video now. And there I am. Okay, hello, everyone. Thank you so much for joining us. I'm James Garcia. I'm the coordinator of this conference. I'm also the communications coordinator for United Cerebral Palsy. And we started this project. This is our third year now for the project. So I want to thank you, those of you who have come back to it and visiting with us again, and those of you who are new to this project. I think it's a vitally important project. It's really a one-of-a-kind project in the country right now that is trying to address these issues specifically from the perspective and impact on the Latino community. So we're going to start our sessions today with a panel discussion entitled Refugees with Disabilities. The title is a little bit limited in that it can refer broadly to refugees, asylum seekers, and to some degree or another, certainly pretty much any population of migrants who are coming to the United States and find themselves here by whatever means that they arrive, and specifically the issue of disabilities, those who come to this country with disabilities and may be coming from other nations where they may have had equal or comparable accessibility to services, or they may be coming, as people often do, who arrive here in duress and are escaping difficult situations. They may be coming from countries where the kinds of services that we offer in the United States are not necessarily available. Part of the conversation today, I think, or much of the conversation today is going to focus on the reality that a lot of people do arrive, and they may not even know they're necessarily facing a specific disability. They may come with their families, children, who may be living with a disability that has not been diagnosed, and they discover that when they get here, or they arrive and they simply just don't know the rules or the laws or the lay of the land, including provisions and the impact of things like the Americans with Disabilities Act, which, despite its title, does not only apply to U.S. citizens. and we will get our panelists to discuss that. So what I'm going to do is go one by one, introduce our panelists right now in sequence, and then have them provide a 2-3 minute overview of them, just who they are, their position at their organization, and the work that their organizations do specifically, and then we will proceed to to a more roundtable discussion on these issues. So let me begin with Jacy Farkas, who is the director of the Sonoran Center for Excellence in Disabilities at the University of Arizona. Jacy?
Thank you, James. Good morning, everyone. As James said, I'm Jacy Farkas. I'm the director at the Sonoran Center for Excellence in Disabilities at the University of Arizona. And we are a federally designated University Center for Excellence in Developmental Disabilities. And we are authorized through the Developmental Disabilities Act. And so as a center, we are tasked with engaging in research and evaluation related to developmental and other disabilities, interdisciplinary training of future and current professionals, as well as development of model programs and services, and technical assistance, community training, and information dissemination. And so, we really look at things across the lifespan and really also focus on how the intersection of disability and other underserved, unserved, and marginalized communities is really a theme throughout all of our work. And so we've been fortunate to be part of initiatives and activities in our state here in Arizona that have focused on the needs and supports and addressing some of the gaps related to individuals with developmental and other disabilities who are also refugees. And we have a high population, refugee population in our state. And so, I'm happy to be here and thrilled that I was invited to share kind of some of the things that we've learned from one of our recent research projects and the ongoing kind of community outreach and partnerships we have with folks in Arizona as we try to best support this unique and very diverse population.
So Jacy, actually, before I go to the next guest, you reminded me that you do have a recent research project. Could you provide some of the highlights about that now? Maybe take about 5 minutes or so, and then we'll go to the next.
Sure. Our state's Developmental Disabilities Planning Council, they had been doing some work previously and through a state kind of wide group, what we call the Refugee with Disabilities Roundtable, focusing on how we can best support this community. And they had done an initial report and study that had really provided and got more input from service providers in the service system. And so they were really interested in wanting to hear more directly from those with lived experiences. And so we had a recent research project called Elevating Refugee Perspectives about Access to Disability Services in Arizona. And we used multiple kind of methods to really center the experiences and hear directly from the voices of individuals with disabilities and their families. And so through group concept mapping, as well as in-depth interviews, and policy review, we were able to kind of identify some key few kind of gaps and needs as it relates to this population accessing disability services in our state. And of course, one of the #1 things that have come up is really the cultural and language barriers that individuals and families face through the systems, and how there is a limited access to qualified interpreters to be able to engage with the systems, as well as providers and others that may have some of the same language skills, who can provide some of the supports and services available. But even just accessing and getting to the point of trying to receive services is a huge hurdle for a lot of individuals. And in part just because of the system barriers that are in place, and that there's even kind of some of these gatekeepers, whether they're from how informed and educated folks are within ethnic-based community organizations that may be working with individuals and families, or physicians and others who have maybe have more contact, and who individuals and families are really looking to for some of this information. How much they have at their disposal and be able to share that back with families can be a real barrier for them in trying to access some of these services and supports, or even just trying to become eligible. And the number of times folks may have to, unfortunately, go through to appeal the process of being able to access long-term care services and supports in our state. And there were some instances, even with families who they were found eligible through the DD system in our state, but it still took over 10 years to access and receive services, so much that a lot of it had to deal with bureaucratic kind of issues, turnover, mistakes on paperwork, there not being an interpreter available, so that meetings were happening, but no progress was moving forward, unfortunately. And so, we came up with a few recommendations on based on what we learned from individuals and families around ensuring language access, and looking really at kind of some of the policies around that, both for the disability service systems and the refugee serving systems. And then also a lot came up around education and the school systems for families, and how to kind of engage, how these systems and educational institutions could really engage with refugee families to address both their basic needs, but then facilitate really appropriate assessment and support for learners. And then how, what kind of peer support programs, as well as education efforts for some of those gatekeepers I talked about before, that could really be helpful, as well as education to families about the expectations for self-advocacy and the rights they have within disability service systems here in the US, were kind of some of the main highlights that came from our study. And I'll be happy to share in the chat a link to some of the resources in the report that we have that folks can check out. Yeah, I'll do it to everyone.
That would be wonderful. So allow me, I'm going to go now, if you don't mind, to Mia. And I think this sets us up nicely, because you're sort of alluding to your report and some of the highlights, and we'll come back to it in a moment. But Mia is involved, has been involved already in research on this, and now has a report that's coming out soon that I'll allow her to describe. But Mia, take it away, tell us who you are, and then let's dive a little bit into your report, highlights, goals, that sort of thing.
Yeah, thank you so much. I'm so glad to be here. My name is Mia Ives Rublee. I am the Senior Director for the Disability Justice Initiative at the Center for American Progress. We were one of the first think tanks nationally to have included disability policy within a general think tank. And so one of the great things that I get to do is work across issue areas to really look at sort of more nuanced disability policies, including areas around immigration and refugee status. And so, just to give a little bit of background, I grew up in Greensboro, North Carolina, where we had quite a large refugee population. And so it's always been a subject that I've been very interested in. And so, was working with my colleagues to discuss the issues around what disabled people faced in terms of sort of coming to the United States. And also I identify as an immigrant. I was adopted and came to the United States at the age of 3. So all of these issues really interested me due to the fact that I was just reading a lot of reports around issues that disabled people faced when coming into the United States. And so as a team, we worked with the immigration team at the Center for American Progress to talk to them about the various issues and cross sections where disability and immigration intersected. And so our first report that came out was really looking at, as James was saying, looking at the ADA, looking at Rehab 504 and seeing where these pieces of legislation protected individuals, migrants, and particularly asylees when coming to the United States. And one of the things that we were trying to look for and be able to do is really get the DOJ to address that the ADA does protect individuals who may be undocumented and in the United States. We're still working on that. But at the same time, while we were doing some of that work, we ran into some conversations around refugees. And so we decided to work on a project around refugees. And we interviewed 5 or 6 different refugee offices in 4 or 5 different states to talk to them about the concerns that individuals face when coming into the United States. And one of the first things that we did was try to somewhat calculate how many refugees had disabilities. And unfortunately, there's no really good number to figure that out because we don't track that across the world very well. But what we did do was do a basic estimate. And so we estimated about 17.6 million displaced people have some type of disability, and that at least 5.8 million refugees have a disability. We think that's a major undercount, but it's the best number that we could sort of pin down. At least 21.4% of refugees in the United States report having some type of disability, according to the 2018 annual survey of refugees. One of the things we wanted to know was that the US is one of the few countries that prioritizes bringing in refugees with disabilities. However, refugees, as James said, come into the United States in different manners. Some come in as asylees and then get the status, refugee status attached to them, while others come in initially by plane as refugees from other countries as well. So we began looking at the differences in services that people received given the different ways that individuals came into the United States. And one of the biggest factors that I kept on hearing over and over and over again from different states was that the asylees that came into the United States, often through the borders, were individuals who often, when they were categorized as refugees, they weren't really informed of the services that they were eligible for. And so many of these individuals weren't getting the medical screenings that they were eligible for, and then time would run out where they no longer were eligible for those services. And so that was a major concern for a lot of these agencies, was that they had a lot of individuals who weren't receiving the services that they were eligible for because they didn't know about them. And so, you know, we began looking through all of the different services that individuals refugees were eligible for, looking at the time spans that they were eligible for, and looking at how long it would take for individuals to get connected with these services. And one of the interesting things that I want to echo from Jacy was that education was a major issue for individuals with significant disabilities. One of the families that we actually interviewed talked about how it took 3 or 4 months longer for them to get into school than their non-disabled siblings, due to the fact that there were just a lot of different evaluations and lack of services that were available at the time that the individual was trying to register for school. And so they were already significantly behind their siblings in getting into school based on those issues. We also found that even though individuals were evaluated before they came into the United States, often those evaluations were not fully done. So things were missing out of the evaluations, and that the partners that were placing or helping house these individuals on the ground weren't getting the full, all of the medical information that they needed in order to find the correct apartments, find the correct equipment and services for the individual when they landed on U.S. soil. And so some of the providers were talking about how they would have already rented an apartment for somebody, and they come in to pick up the individual, and they realize that individual is in a wheelchair. And then that actually shows that they got the wrong apartment and that the apartment wouldn't work for the individual. And so they had to go back to the drawing board or figure out other ways to get the individual into the apartment until they were able to move the individual into a more accessible location. We also had an individual or heard about an individual who came to the United States and was in actual kidney failure because they weren't getting the right treatment while on the plane, and thus had to immediately go to the emergency room because they were in such rough shape when they landed in the United States. I think also one of the interesting things that we found out about was just the differences in situations, particularly for some of the Afghani refugees that are coming into the United States, because it had been such a rush effort that a lot of these individuals, it was literally trying to fly the plane while building it. And so there were significant concerns about trying to get these individuals established with services on day one. The last thing that we heard from folks was just the continual issue of having medical documentation, but that medical documentation not being enough to qualify for things like Medicaid and SSI and other disability services as soon as they landed, because the qualifications of the doctors abroad weren't seen as useful to the folks that were making the determinations. And so one of the things that we were talking about was, it was interesting that these doctors who were doing the evaluations had all of these requirements put on them to be able to do the evaluations, yet at the same time, they're not trusted enough to provide enough documentation to make these individuals eligible for disability services once in the United States. So those were a lot of different concerns that we kept on running up to. And one of the things that we created a couple of suggestions, and we're hoping that this will be published by the end of September. And one of those things was forming a federal interagency committee to evaluate the resettlement process for disabled refugees. And we also talked about the importance of updating overseas medical diagnostic and intake forms to be more inclusive and thorough regarding disabilities, and ensuring timely transmission of those forms to resettlement agencies in the US. And then lastly, also ensuring that we're creating federal guidance on serving disabled refugees for resettlement agencies and medical providers, which was one of the things we kept on hearing from resettlement agencies over and over again.
Okay, we're going to go to our next speaker here in a moment. I'm trying to turn my screen on. Unfortunately, it's not letting me. Oh, let's see. Not yet. Alexis, I don't know if you can hear me, but if you, oh, there we go. Start my video. Thank you very much. I appreciate it. So we're going to go to our next speaker. First of all, thank you so much for that overview. I think that combined with what Jacy discussed gives us a kind of lay of the land. Before we go on, I do have one minor question for Mia. The 17.6 million number that you referred to, what was that referring to? What was that a reference to?
That was that was a reference to the number of displaced people. So not refugees, but displaced people overall.
Okay, and in what geographic area? You mean in the United States or across
around the world?
Oh,
right
now. Okay. All right. It could seem like a very high number, but thank you so much. Okay. All right. So great. What I'd like to do now is let's go to Josue. And Josue, I apologize, but am I pronouncing your first name correctly?
Josue? Yes.
Oh, Josue. Okay. Josue Rodriguez of ADAPT. You're based in El Paso. Tell us about ADAPT and your work there. And then feel free to elaborate a bit upon what has been a reality really in that border town. I know the area because I worked in Texas for many years and visited often. But talk about the work you guys are doing in the context of what we've been sort of witnessing over the last 3 or 4 or 5 years in terms of the humanitarian crisis and the somewhat chaotic response to it by our government.
Yeah. Well, good morning. My name is Josue Rodriguez, and I am an organizer with El Paso Desert ADAPT, Adaptive Texas, and RevUp. ADAPT is a national grassroots disability organization that advocates for the rights of people with disabilities to live in the community with the services and supports that they need. RevUp stands for Register, Educate, Vote, and Use Your Power, which is an organization that mobilizes individuals with disabilities and those people around us to get out the disability vote, or what we consider the disability vote. So it's been an interesting situation here in the border because of the influx of immigrants coming into the United States. Many of them, again, with disabilities that need certain types of services and supports. One of the biggest things that we have noticed, especially with our, we have a shortage of community attendance as it is to provide services for people with disabilities. And that's one of the things that I think is affecting our population, whether it be immigrants with disabilities or non-immigrants with disabilities. And a lot of the issues that we're facing or what some of the things that affect our people are our attendants coming in. A lot of them are people of color, women, and again, sorry. So for the border, I think we have had an influx again of immigrants coming in, and the biggest issues and barriers that I think we are confronting are being able to connect these individuals or even identify refugees with disabilities and be able to connect them with the different services and supports that they might require to be able to obtain services. I don't know if you have any other questions or anything that you want me to
One thing I
emphasize.
would like, yeah, before we go on, one thing I would like to elaborate on um, uh, is it a sort of a regular occurrence that either through your organization or some of the sister organizations in that area that that you're finding a substantial number of people with some form of a disability who are arriving as part of the population that are coming? And of course, the challenge is that we're not just talking about the sort of apparent or visible disabilities, but obviously as well invisible disabilities. Yeah.
Yeah,
You
there are what we since we collaborate with different organizations, one of them being the Center for Independent Living Center here, we have noticed that there are again an influx of people with disabilities with different types of disabilities coming in uh to through the border. And again, that's what our part is to connect them with the services and the supports that they might need.
Are has there been conversation? Because I imagine you interact with also some of the other NGOs and folks who work with refugee or migrant populations. Has there been have there been conversations about whether the people who are doing the detaining, the Border Patrol agents themselves or immigration agents or ICE, if they seem to be trained and informed about the possibility that the folks who are arriving may in fact have a disability that needs to be addressed?
To my knowledge, there is some training that has gone on in regards to identifying and dealing with people with different types of disabilities. Especially when there's like cognitive disabilities or um, even with the language barriers. I think that's one of the biggest things to being able to obtain services is the language barrier and being able for the individual to um, communicate what their needs are. But yeah,
And
there are different agencies out here that are working on making sure that um, that the people that are doing the detentions are being trained on how to deal with people with disabilities.
right, and speaking of language, I imagine at least the reports that I have seen over the course of the last 10 years, particularly the last five, people who are coming seeking asylum and refugee status are coming from all over the world now. So while it may still be predominantly Latin American, people are coming from all over the world, and so that means other languages. Are you hearing conversations about that as well?
Yes, there are again. There's like you mentioned, they're coming from different parts of the world, and there are efforts to connect people uh, with interpreters that can interpret different types of languages.
Okay. Okay, I'd like to go now to Venícia. This is if you could please speak about some of the work you're doing here in the Phoenix Valley with through your organization, and specifically some of the anecdotes of direct experiences you've had with refugees coming and seeking asylum services. I'm seeking
Abs-
services.
Absolutely, Mr. Garcia. Thank you so much. And I want to thank everyone who has spoken thus far. Um, it's like you know my life. It's like you know what we do here. Every one of you have already touched on what we do, specifically my job. So my name is Venícia Mayo Burton, and I work with Catholic Charities here in Arizona, specifically in Phoenix. Um, I am the compliance coordinator for refugee programs. And again, everything you have mentioned is my job. It's what we do. Um, so yeah, so a little bit about what I actually do. So my job as coordinator, I walk alongside our case managers and our other stakeholders and our providers. So be that the Department of Economic Security, Social Security, um, uh, DFACS, or excuse me, DCFS, sorry, um, and any of the organizations. And as you know, Catholic Charities is one of 9 resettlement agencies across the U.S. And that's what we do on our side of the house. We support refugee families, not and we support different statuses. So refugee, migrant, IDP, asylee seekers, asylees, and Cuban and Haitian population, as well as our unaccompanied minors, which will fall under all of those statuses, but because they are minors, they have their own classification. So yeah, I touch many, many lives, and I'm impacted by many, many lives here. So I think also what I'd like to do, because before stepping into this role, I was not very well versed on the differences between refugees, asylees, migrants, immigrants. So without giving a complete history lesson, I just kind of want to touch on some of the major differences. And I'll start with maybe the biggest one, which is refugee. And yes, we are having families come from all over with many, many different languages. Quick, before I go into the refugee, I just had my first family last week that spoke a language and a dialect that was not included in our database. And we have over 300 interpreters that we work with multiple languages, different dialects, and they did not have a person to speak this particular language. That was my first one in 3 years.
And
So
what was
that
the language? I'm sorry, what
it,
was
y- oh my goodness, it's almost Kinyarwandan, but it is Iliarwanda,
in what region of the
Iliarwanda,
world? Just what region of the world?
near in Africa. So Rwanda,
Okay,
the Democratic Republic of Congo, in that region,
I
in
see.
between. Yeah. So how they explained it to me, it sounds a little bit like Swahili, but the family, and so we thought maybe a Swahili interpreter, but they could not communicate.
It's difficult.
Uh,
Yeah,
yeah.
challenge.
So
I'm
yeah.
sorry. I'm sorry.
It was like, I just wanted to share that because that was my
Yeah.
first
Yes.
time. And it's just amazing. But anyway, I digress. So refugees, and again, you all know this, but these are our families that are fleeing. There's conflict, there's war. They're actually fleeing. They may have been in a camp already and just waiting to leave, or they were forced to leave. So they cannot return to their home country. I guess that's the biggest difference for our refugees. Asylee seekers are also fleeing, but their reasons for fleeing may be a little different. And it's also due to how they come over to I'll just speak to America, but how they arrive here, crossing a border, or some other means, and on an arrival, and then they will ask for a status. They will ask to seek asylum here. And then we have, migrants who voluntarily have left. And again, the biggest difference is, and there may be conflict as well, but they can return to their home country. Again, just one of some of the major differences, because I and my naivete, and just not knowing and not being educated, I wasn't well versed on the differences and why there was a status associated, but just an overview of that. But again, that's exactly what we do. Speaking to, I think it was Mia, a lot of the challenges, language, interpretation, understanding, education, fear. We meet some of our clients at the airport. We have had many cases. We have a specific department. We have one case manager that handles cases, like you mentioned that we had a family that came over with a family member that did have kidney issue, and we sometimes don't get our information until like 24 hours in advance. Um, uh, and we're already at the airport maybe, but we have arrived several times, and a lot of times we will go straight from plane to ER. Um, straight from the airplane and directly to the emergency room. We do that because again, we walk alongside the families as soon as they arrive. Um, I think, James, you asked some other questions I may not have answered.
No. No. Everything you alluded to has been extremely helpful. And just for anyone else who wants to jump in on this, in terms of the clarification for refugees, in kind of simple terms, sometimes I think of that you could be a refugee because a hurricane, wiped out your city, and you need to go from there. I mean, there were people who, and they're U.S. citizens, of course, but people who came from Puerto Rico after Hurricane Maria by the thousands, right?
Right.
But some people come from other parts of the world, earthquakes, drive them, north, and are looking for work and that kind of thing. And then asylum seekers seem to fall more into the category of there's something politically happening where they're from, and there's a fear of retribution, intimidation, that kind of thing.
Absolutely.
So they're having to seek that. And then, as you mentioned, migrants. And all of those are category. And then as well, on top of all of that, there are people who are who come documented, have a visa, have permission to come, and may yet be faced with some sort of a disability. Right?
Absolutely.
So it's a whole other category.
It's a
And
whole
one
other
of the things, one of the last things I'll mention is the thinking of Ukrainian refugees. The number of them have climbed substantially, and Russian refugees have come.
Absolutely.
And asylum seekers. And some of those folks are escaping an actual war. Right?
Absolutely.
Leaving a war zone, cannot escape, cannot return. So the range, the pantheon, and then that, of course, brings us to what kinds of disabilities. It could be somebody who had a wheelchair where they lived and they had something like cerebral palsy, or they had a condition that made their mobility difficult, or it could be that they were even injured in transit coming here.
Absolutely.
Have you seen kind of that range, all of that range? It sounds like it.
All of it. We have seen all of it. My eyes have really been open to a lot of challenges. Again, my first experience, speaking to you, Mia, because part of what we do is establish housing. So we're at the airport, we pick up a family, and we're taking them to their U.S. home. And we have had instances where we arrive at the apartment and there's 3 flights of stairs. And our family, someone is maybe wheelchair bound. We have had instances, and we have immediately, gone from there directly to a hotel where we can have immediate access. But the clock starts that minute. We're at the leasing office in the morning, getting what we need for our families. But that's exactly, we are facing that, and it's more prevalent.
Those of us who have somebody with a disability living in our households find ourselves showing up at hotels that claim to have had a room for somebody who's disabled, and it's not.
Yeah,
so
and it's not.
Too. I'd like to ask either Mia or Jacy about this in terms of the research that you've done. Are we dealing predominantly people with disabilities who may be in these categories who are children or adults? And anyone feel free to jump in on that. I mean, what's the sort of the demographic makeup of the folks who are coming in? Mia, any thoughts on that in terms of the research that you did?
We actually didn't see a huge difference between the numbers. Our main focus was sort of how services were provided depending on the differences in children versus adults. So we didn't look at the numbers per se, just because it's very hard to get numbers on these populations. So our main focus was just like, how are we providing services depending on the specific age of the individual?
Okay. Jacy, did anything come up in your research for your report about?
Similar for us as what Mia was saying, we weren't looking at numbers of people and we tried to, at least as we recruited individuals and families to speak with us, we tried to look at folks and have some representation across the lifespan, so we could see what some of the issues were, whether it was because of children in the education system and hear what that looks like versus adults at different ages trying to access services. So we didn't look specifically at who was in the population, just making sure we were hearing what the needs and concerns were related to kind of some of the different lifespan.
I want to come back to the education point subject in a moment, but Mia, I know you have to leave in a few minutes for another engagement, but I would like you to speak to the rules about the ADA. How do our constitutional rights or specific legislation like the Americans with Disabilities Act, why are people who may show up as refugees or asylum seekers entitled to that? I think a lot of people don't necessarily know that they are.
Yeah, I think a lot of people, when we're looking at sort of the language of the ADA in general, what we've seen from court cases is that any individual who is touching U.S. land or U.S. territories are covered under the ADA, even though it says Americans or something like that in there. It does cover anybody on land. So that's what the courts have decided. If you were to go into another country as a U.S. citizen, but were utilizing services from another country, you wouldn't be protected under the ADA. So that's the real difference. And one of the reasons why we actually are focusing on the ADA is because of the Olmstead decision, particularly for youth and unaccompanied minors. We have found through our research that there is a much higher burden for us to get children, unaccompanied children, out of these quote unquote group homes, particularly if they have behavioral disabilities that affect their behaviors. And it requires much longer home studies. It requires specific certifications to be able to get these kids out, even if they're going to families or relatives when they're leaving these institutions. And so what we've been trying to do, particularly for children, but for all of the individuals, is talk about how Olmstead protects these individuals in being able to live within their communities. And so we're trying to speed up the process of getting these individuals, particularly migrants and asylees who are coming from the border, to get them out of these sometimes prisons, state prisons that we're trying to get them out of, to say these individuals are not receiving the correct treatment, they're not receiving the correct medical care, they're being punished for having a disability, and this is against our laws through the ADA. And I think a lot of people rely on 504, Rehab 504, which is specifically targeted to federal dollars or programs run by the federal government. And that makes sense, but we do have other tools to utilize legally to continue to push to get people access to services and supports that they need to be able to settle within the country and become independent.
Tell me this, if you can, when and there's some alphabet soup, if you will, in terms of different laws that are applying here, but it sounds like basically we have obviously our U.S. Constitution, we have the Americans with Disabilities Act, we have the Rehabilitation Act, which I think is from 1973. Then you just mentioned Olmstead and 504, and so there's a number of things out there that apply more than most people probably imagine, and certainly maybe asylum seekers when they arrive, not realizing necessarily that they're entitled to protections sometimes under these. Who enforces that? Who is there?
Oh boy!
And I know you only have 3 minutes, but who enforces?
We do, unfortunately. You know, they're not active laws. We call them sort of. They're very inactive because there's no real enforcement arm. We don't have a lot of funding for enforcement. And this was due to some negotiation between Republicans and Democrats on how we would get this type of legislation out. And so a lot of it has to do with lawsuits. We file lawsuits. So getting disability rights groups, getting immigration groups, having them work together, which we have actually seen quite a bit recently, to try to enforce the laws that are on the table. I think a lot of times we're like, oh, let's make a new law, let's make a new law. And we're like, no, like we have the laws on the books, we just need to enforce them. So that's the big thing that we're trying to do, is get people active, get them to file complaints. I know, particularly for the disability community, it's hard. Like, our lives are hard enough. But unfortunately, that's what's required of us to be able to ensure that people behind us are protected. You know, like maybe my rights won't be protected today, but the rights of others behind me may be protected later on. So unfortunately, it's just right as a result of lawsuits. So it really is about the public pursuing these things. So thankful for some of the administration that has been pursuing some of this, but they just don't have the resources to really do the all-out approach that needs to happen in order to protect the rights.
I think I'm hearing that, for instance, the Food and Drug Administration may have people who do inspections, and so they're kind of an enforcement arm, but the ADA doesn't necessarily have an enforcement arm per se, unless you go to court. Right. And then in our audience yesterday, we had some representatives on from the National Disability Rights Network, which has been described to me sometimes as the ACLU for disability rights, and someone also from the Arizona Disability Law Center.
I wish they had the money that the ACLU has.
Right. Yeah. yes. Maybe we can just do a call out and ask them to share on this call.
Yeah.
All right. So I want to turn to back to Josue for a moment. Josue, can you talk to me about some of the real world examples, some anecdotes of 2 or 3 people who you've seen over the years come to the El Paso area who have had disabilities, and what kind of disabilities they've been dealing with when they arrive?
Well, I can think about 3 or 4 individuals within my circle of friends that have migrated into the US. And I think, again, some of the difficult things for them is actually finding services, finding medical equipment that fits their needs. I think that and like somebody said earlier, just finding knowing about the resources that are available for individuals who are immigrating into the US. I think that's one of the biggest things that we have. Even though, while we do have a Center for Independent Living, and they have an extensive list of resources for individuals that need assistance, whether it be medical assistance, whether it be attendant care, whether it be in types of accessibility, because that's another thing that even individuals who are already here are having trouble with, which is affordable, accessible, integrated housing. That's a big push that we always do push for. That's something that we always push for, is more accessible, affordable, integrated housing, so that we can have people placed in adequate, accessible homes. One of the things that we keep pushing for is visitability, which is to construct housing that's visitable to individuals with disabilities, maybe not the individual living in the homes themselves, but if you go visit family, that it's actually somewhat accessible for you. Those are some of the things that we are working on. We continue to work on. And again, one of the biggest things that we have is when we are trying to connect individuals with, for instance, attendant services. We already have a huge shortage of attendant providers because of the lack of well-paid salaries, because of the lack of benefits, because of the lack of a stable network that supports maintain the recruitment and the retention of attendants into this field. So that's some of the things that we keep pushing for, are not only the individuals that are getting the services, but also those individuals that support us, because a lot of them again are women and people of color, and some of them immigrants as well, that are looking for jobs, and they come in and they like the jobs, and we as people who receive the jobs like working with these individuals, but they'd rather go and work somewhere else that pays uh $15 an hour, $20 an hour, for doing less work than what it takes to actually assist an individual with a disability.
Yeah, you raise a really, really good point. At United Cerebral Palsy and an organization out of Washington, D.C. called Anchor co-produce or co-publish a report called The Case for Inclusion every year that speaks specifically to the shortage of caregivers, direct support professionals, and the attendees that you're speaking to. And it is a massive shortage. And what it often does around the country for our viewers is that it creates a tremendously long waiting list, or something like
Yes.
500,000 people around the country who are just waiting for disability support professionals to help them. So that's a tremendous issue. And for you, Jacy, and Venícia, the services, or Venícia in particular, the services that you're providing, also, I suppose you're running into these situations too, where someone needs help, someone has a disability, and as you mentioned earlier, it could be difficult to find housing that's appropriate. But are there the attendees? Are you seeing the caregivers out there when you need to seek them out? Or are you facing the same issue that Josue mentioned?
For us, we haven't, because, and just speaking here locally, we utilize what we have. So we utilize our internal support system. We also try to educate the family that a family member can be that support. And that's part of, because of course, our main goal is self-sufficiency for the family. So we try to include that as part of a family, an educational component, where we can say, hey, family members can be an aid. Family members can do this. Family members can provide this service. But as part of our wraparound, we also have volunteers that provide that same, those kind of services. But Josue, you're right. It's we may find a volunteer or an aide that'll go for 2 hours a day or twice a week or something. But over the long term, how does that help the family? So that's why we try to include it as part of our education. And and then we try to use what we have in the community. And but Josue is right, we don't have enough. There's never enough.
Well, and to address the issue that you mentioned about families helping family members, we here in Texas, we have been pushing for legislation to allow spouses to work for spouses, so that there it'll alleviate some of the shortage of attendance, but also it will provide an extra income to the individual family when they're already providing the services. So that's one of the things that we've introduced legislation before on, is the spouses working for spouses. Because sometimes if you live in the same home as the individual who receives the services, sometimes there's barriers depending on the program on whether you're able to obtain services from somebody living in your own home.
Yeah,
Absolutely.
And Josue, you raise a point that's a conversation all over the country in different states where, some states have it, some states don't, where a family member who's providing care for someone with a disability can seek remuneration, right? They can be paid on some level. Otherwise, there are millions of people who are providing free services to a family member to care for them because they don't have a facility or can't live independently, or for a variety of reasons. Jacy, I'd like to go back to education now as we start to close out. Got about 18 minutes or so here. But in terms of the education issue and public education or schools, expand a little bit on what your report found in terms of accessibility out there on those issues, and if school districts and school personnel are informed about the need for these services.
So one thing to kind of preface a little bit with this for our state in Arizona, there's a real, our state runs on local control when it comes to the school system. So it's everything happens at the district level. And so, you know, some districts and schools, because they have even more families from refugee communities, might be more in tune with it. And if there's folks who are advocating it, we had some representation on our community advisory board from a school district because it's a focus area for them and something that some of their administration has been passionate about to support education and providing direct intentional services around refugee families, and particularly those who might be in special education. But it runs the gamut across, depending on what school you're in, what school district, of how informed and educated people are, the teachers versus like administrative staff, and access to resources. I mean, legally required to provide interpreters, but how much folks can actually access that in time for an IEP meeting is a whole other, unfortunately, a whole other barrier, right? And that even a lot of the materials being available for families in their language. And on top of that, just because something is translated on paper doesn't mean that family can understand it and has the literacy level in their own language to read that information. And so it's really important that there is an interpreter, someone who can really explain, or an advocate that can come with them to explain what some of these things mean for them. One of the resources that our Refugees with Disabilities group, and that was part of the link I provided, are a series of fact sheets in 6 different, like the most common languages among refugee populations in our state that are focused on education and kind of understanding IDEA, what their rights are, what they can expect and ask for, even just kind of some basic understanding of disability in the system as it relates to education and what they can ask for. But some of the families we spoke to, you know, they really didn't feel empowered to be able to be part of even the IEP process. And when they would share and try to talk about what, you know, like, we know our child best, and felt like it was discounted, right? Or not really listened to, or they came to the meeting with, these are the goals and priorities, but have not, and just, this is what we're moving forward with, without any input from the family. And whether or not that family, the child was even present, if, especially being in high school, as part of their IEPs. And I do want to say, because I saw this in the Q&A as well, that what we found, it's a lot of the same issues and barriers that all disabled individuals and families are experiencing in our communities. It's just exacerbated by some additional barriers, whether it's cultural, language, or other attitudes, and even those individuals and families, their experience and understanding of disability from the country they came from. So a lot of this isn't new, the barriers folks are experiencing. They're just added layers of complexity and understanding to be able to provide the best services and supports for them. So I just want to at least acknowledge that, because it's a real thing for everybody, but there's just additional layers that are added on top of for these communities.
Yeah. Let me have you, if you can, when you speak about your report, were there some recommendations that you had in the report about, you know, solutions to some of the issues that we've addressed? And can you outline those briefly, and then I'll go to a couple of questions in our Q&A as well.
Sure. Specifically around kind of the education, you know, really trying to bolster some of the primary and secondary educational institutions to be able to engage with refugee families. And some of that is educating staff at different levels, knowing that there are complex needs of the family, and to kind of think of disability as one of the things that they're struggling and trying to deal with as being new Americans, you know what I mean, being new to the US, and just even accessing basic needs and self-sufficiency within the time frame they're allowed under refugee status. As well as, you know, a lot of the assessments and diagnostic activities that happen in schools they're based on norms that are here in the US, as well as, and for the most part, on like historically, it's been on white male Americans that a lot of these have been developed under. And so if we're talking about especially some diagnoses that, like autism, for instance, which may not even people from where they're come from had never even heard of, you know what I mean? But culturally, how someone engages with other people, whether it's around eye contact or other kind of social behavioral type of pieces of the assessment, are really different. And then if you're doing it in a language and through an interpreter, a lot is lost in translation, you know what I mean? And so it's the whole process is pretty difficult. And so trying to find ways that to improve some of those systems, education, or for folks around that can really assist, I think, is what we kind of recommended, as well as one thing I kind of, to kind of piggyback on that Mia said earlier, there's a whole issue of like, there's no tracking of this information of refugee status among disability service systems that can make it difficult in terms of even looking at actual data in terms of if we wanted to assess like time it took to receive services, or looking at how often or how language access was done. Like some of those things aren't tracked necessarily. We don't know the exact number of folks. And so one of our recommendation has been around the way data is collected and shared among some of the different systems that could be really helpful for having a better understanding about the procedural systems barriers that could best support not just refugees, but a lot of folks who are part of those systems by having some of that data. So those are kind of some of the other key things outside of that I mentioned earlier.
Yeah. Those are helpful. No, those are very helpful. And one of the things I think that we've heard throughout the conversation is really about data collection. Who's collecting the information about these populations? And admittedly, it's difficult in part because a lot of them are in transit and they're moving, and they don't necessarily stay in one place for a long time. Even once they arrive and they start to get settled, then maybe they have family in other parts of the country and they have to go there. Those kinds of things. But I also think that and maybe Venícia, you can touch upon this, sort of your sort of best practices, things that you've learned, that 2 or 3 things that you think might be really helpful when it comes to addressing the needs of this population. What have you sort of found just over the course of your experience now that you think, you know, these might be simple things, but they would really help us in terms of resettling folks?
Absolutely. And again, Jacy, you know my life, you know what we do. I think adding, you know, just that psychosocial component to our families, because we're missing that. Like she said, you know, we are used to the norms, you know. Example, it took us 6 weeks to get kiddos enrolled in school because of immunization. That was just immunization. And that's not a norm. Normally we're, you know, but there were complexities to this one because of you know, in order to do this, you have to have an ID. In order to do this, you have to read. In order to do this, you have to understand. And they don't understand. So like she said, like all of these extra layers and these different nuances. So I think what what we have tried to adopt, we try to escort parents, to school enrollments. IEP, they don't know what that is. Like autism, that doesn't exist in a lot of it exists, but it's
not
not
necessarily
heard of. Yeah, it doesn't
or properly diagnosed.
diagnoses.
Right.
Again, culturally, and then there's stigma associated with other things. And so families, a lot of times, even though they might have an idea, but there's a stigma associated to whatever that is. So they won't talk about it. They don't mention it.
You
A
raised
lot
a
of
really good point that we probably should have spoke about at the beginning, is that there are a number of these populations who are coming from countries where there is heavy stigma, very heavy stigma.
heavy. Yes.
So just acknowledging it and letting you know, for instance, or letting federal authorities know, or is sometimes part of the first struggle, right?
Yeah. And a lot of times they won't, because right, they're waiting for an answer to stay here. They don't so it's scary. They don't want to open up anything additional, for fear. Again, but and with school systems, they don't want to ask a lot of questions because they don't know that it's their right. Culturally, a lot of families that we see, K through 12 is not the norm for them, especially young women. That's not the norm. You might go to school for a couple of years and then you're home. Um, so yeah, it's these nuances, but stigma's a really big one,
Yeah,
for
we
families.
didn't even get into that, and we won't have enough time to really explore that too much. But I do know that this is a kind of a running theme for this conference and various panels. The idea of breaking through stigma, sometimes on lower income families, sometimes immigrant families, etc. Just making sure that they understand you have a right to these services, right? Or you shouldn't be embarrassed if your child has a condition that needs to be addressed, and then the sooner the better, right? Childhood early intervention is something that's always talked about in the disability community. Yeah. I want to allow you, Josue, to close with a couple of comments, perhaps, about if you feel as if there is a real awareness in your community broadly, the topic of asylees, refugees, migrants coming through certain ports of entry or certain regions of the border, just as one example, whether it was Eagle Pass or El Paso or other areas. Obviously a lot of that in the news, almost nothing ever mentioned about anyone with a disability. So what do you find on the ground? Do you have to constantly sort of raise this issue with people?
Well, on the issue of refugees, it is evident throughout the community, because again, they come through the port of entry, but then they're scattered throughout the city. So you see a lot of refugees like at Walmart or out in the street, or just integrating into the community. Now,
Mhm.
the part of being, whether they identify people with disabilities or refugees with disabilities or not, I'm not too sure about on
Mhm.
that part, but that they are integrated into into the general community. They are, because we see people again, um whether it be at bus stops or whether it be at Walmart or at restaurants, and you can sometimes identify people depending, again, like we were talking about, the language barriers. There's times where actually have to help or assist some individuals who may only speak Spanish, but then they're trying to obtain something from the store, and they're talking in Spanish, and they're not being understood, or they're being misinterpreted, and then you jump in and assist. Those are some of the instances where you find individuals are being more integrated into our communities. But as far as being identifying them with as people with disabilities and obtaining the supports that they need, I'm not too clear about that
Yeah,
part.
I guess part of what I was alluding to is the idea that whenever you see a mayor or even a sheriff or the governor, for instance, of Texas, go to the microphone and talk about these issues, not once have I ever heard anyone say, and by the way, a certain segment of these people have disabilities and we should address that because out of humanitarian concern, you should treat people, with a certain
Well, but
level of dignity.
I think that that's the part.
Yeah.
That's the part that I mean, depending on the stands of the governor or any other politician on how they view immigration,
Mhm.
it would be I don't think it'd be to their benefit to actually um see some of these people as humans and actually needing supports and services. And I think that that's one of the things that that by not mentioning some of these things, you take away part of the human aspect of the whole immigration.
Right. Then it becomes solely maybe a police issue or that kind of thing.
It becomes more of a political issue. Yeah.
All right. Well, I want to thank all of you. We'll close out here today. I want to thank you for really a robust and really interesting conversation. Mia Rublee from the Center for American Progress, of course, had to leave it a little bit early. She had another engagement, but be on the lookout. They have a website, of course, and be on the lookout for their upcoming report on these topics. And Jacy, if you don't mind, if you could put your link for your report in our chat box again, that would be great. Someone asked for it and had logged off and gotten back on, but I can also send it out to the attendees to register for this event. But I want to thank you on behalf of the Sonoran Center at the University of Arizona, and then Venícia, thank you so much for coming on behalf of Catholic Charities. It's really enlightening, really informative, and I thank you so much for everyone for your time today. We're going to take about a 15-minute break and come back at 35 past the hour to start our final panel discussion for the day on language access and children and families with disability issues. Thank you so much, everyone, for being here today.